We are here at Gulf Coast Plastic Surgery in Pensacola, Florida, and today we want to teach you in the next couple minutes about a surgical drain. So why we use surgical drains: if you have a drain in your body, that means that your surgeon created what's called a potential space. So think of this as like a tummy tuck, for example. The skin and the fat layer of your abdomen was lifted off of the muscle layer. The extra skin and fat was removed, and it was sewn back down in a new position. So there was a potential space created underneath the fat and above the muscle, and if there's no drains in place and certain sutures aren't placed, this can collect fluid called a seroma. The purpose of a drain is to drain this fluid so you don't get a seroma, because the problem with seromas, among other things, is that it prevents these tissue layers from healing, because the two tissue layers that need to heal. So the purpose of the drain is to suck the fluid out. The purpose of a compressive garment that you might have been told to wear is to put external pressure on that tissue, which then helps force the fluid out the drain. Okay, so think of this potential space, the space between these two tissue layers that were separated, as a balloon, like a birthday balloon. And if these two layers don't heal, it's like forever a birthday balloon that can keep filling up with water or with seroma fluid. Now, if your body heals that space because the drains keep evacuating the fluid, then it's kind of like squirting some glue inside that birthday balloon, because the scar tissue your body forms is like glue. And once these two tissue layers heal together, kind of heal together like this, then you can no longer blow up the balloon because there's glue there. So what we want to do is we want to leave the drain in long enough so that your body can put glue between those two tissue layers so it can no longer accept that fluid into that space. So if you want to come over here and take a look at this IV fluid bag, which we have filled with iced tea, with a surgical drain inside. The surgical drain is not to suction. We'll put it to suction by taking the cap off, squeezing it down like this, putting the cap back on, and now it's going to start sucking this fluid out so these two tissue layers can heal together, and once they heal together we can take the drain out. Alright, so once this thing gets full, which I'll show you here, we'll kind of move the bag around so it'll work a little faster. Once we have enough fluid in here and it gets full, what we'll do is we'll basically pop the top. There's a valve in here, so it's not going to push anything back into your body. You tip it over into your measuring cup and squeeze it out. Once you squeeze it out, you want to measure it so we can record how much comes out. So right now we just evacuated 40 milliliters. So on your drain log, you'd write down date, time, 40 milliliters. And then when you come to your appointment, you can show your doctor how much fluid has been coming out of your drain, and they can decide whether or not it's appropriate to remove it. So next we're going to go through some common mistakes people make when they have a surgical drain. We have our illustrious Gulf Coast Plastic Surgery crew. They're going to come on over and we'll teach you some common mistakes people make. So this is Brittany. Brittany's the well-intentioned nurse. Well-intentioned nurses, what they like to do is they like to set the suction wrong. So Brittany's going to show you how they set the suction wrong.
By pushing in the bottom with your thumb and then closing the top.
So you can see when you do this, it's not even sucking, because the drain, these bulbs don't create suction when the bottom is shoved in like this. So some nurses think this looks cool, but it doesn't actually create any suction to suck any fluid out. So that is not how you want to set your drain. Thank you, Brittany. Next we have the person who wears their drain bulb under their belt. So right now you can see it's sucking again. We'll take it off suction, reset it, put the top on, and now Ginny here is going to put it behind her belt. The problem with this is when you put the bulb underneath a constricting piece of clothing like a belt or a binder or something, it's not free to expand. So there's no way that this drain can suck, because her belt is compressing it down, so it's not creating any suction. So what you need to do, you can take it out of your pants, thank you, Ginny, is you need to wear it in a pocket, and the pocket's okay if it will allow the bulb to expand out. Or safest thing to do is to have it clothespined onto your garment or something like that. That way the bulb is free to expand. Alright, another common mistake is when there's a clot in the line. So what we're going to do is we're going to put some, hold on one second, let's get some Aquaphor we'll shove in there. You can stop it for a second. Alright, so the next problem we're going to discuss is when there's a clot in the line. The clot in the line can prevent suction. So we clotted this up with some bacitracin. Your drain would probably be clotted with blood. And you can see right now it's not really sucking. So what Jessica here is going to do is she's going to strip the drain or milk the clot into the tube so it can once again start sucking like it's supposed to. So grab the drain near your body and hold it tight so you don't pull the drain out of your body. And then with your other hand, pull towards the drain, milking anything in the line towards the bulb. Now that the clot is stripped out of the drain, that the bulb is now sucking once again and removing the seroma fluid from your body. And that is what we need the drain to do. Next, thank you, Jessica. Next, we have Marguerite, who happens to also be our Employee of the Month. Here at Gulf Coast Plastic Surgery, when you're Employee of the Month, you wear a tiara for the whole month. So one common problem is patients will come in, or I'll see a patient in the hospital, and their drain is full. So a drain that looks like this, that isn't compressed whatsoever, is a full drain and it is not sucking. That bulb no longer has any room to expand, and therefore it cannot suck out any more seroma fluid. So you need to empty your drain and record the output in this container when it's half full. So whenever the drain gets half full, empty it out, reset the suction so it's totally empty and sucking nice and hard, because once it gets full like this, it's no longer sucking. So all the fluid's going to be building up in your body and may start leaking around the drain site or give you a seroma. That was Drain Teaching 101 here at Gulf Coast Plastic Surgery in Pensacola. We hope you learned something. If you have any questions, feel free to give our office a call or call the surgeon who put in your drain, and we hope that you have a speedy recovery.